This 16-year-old patient was referred to us for endodontic treatment of tooth number 31. The dentist cleaned out the decay and noticed that she was getting very close to hitting the pulp, temporized the tooth, didn't remove any more decay, temporized the tooth, and referred her to us for endodontic treatment. And you can see this is all cavit, and you can see the proximity, how close the decay is to the pulp. So we went ahead and did the root canal for her, and take a look. And here's the post-op. 3 mesial canals, mesiobuccal, middle mesial, mesiolingual, and of course a distal canal there. Everything went great. As you can see, we temporized the tooth and referred the patient back to her dentist for the permanent restoration. Be really careful with these second molars and their proximity to the inferior alveolar nerve canal. You must be very, very careful with these teeth when you're doing root canals on them. And always trough, of course, for the middle mesial canal. This patient with an extensive medical history was referred to me for endodontic treatment of tooth number 30 by her periodontist. As you can see, the periodontist hemisectioned the distal half of the tooth and wants to save the mesial half of the tooth. So refer the patient to us for endodontic treatment of what is remaining of tooth number 30. Okay, so in these situations, you must be very careful because there is really not much tooth structure that remains here. So you don't want to make the situation worse and perf out this way. There was also some remaining decay, and you can see some old amalgam restoration there as well. So we went ahead and did the root canal for her, and take a look. Remove the remaining decay, and as you can see, we were able to locate 2 canal systems here. Everything went great. As you can see, we went ahead and referred the patient back to her dentist and of course the periodontist later for the restoration, the permanent restoration for this tooth, or what remains of tooth number 30. But as you can see, everything went great. We did our part. This patient was referred to me for endodontic treatment of tooth number 28. As you can see, decay here and another one here, both approximating the pulp. Patient had all the signs and symptoms of irreversible pulpitis with acute apical periodontitis. So we went ahead and did the root canal for her, pretty straightforward. First off, of course, we start with a rubber dam, cleaned out the decay here, cleaned out the decay here, rebuilt the mesial wall, rebuilt the distal wall. So now I have 4 sealed walls to contain my irrigants, and take a look. And here's the post-op. As you can see, everything went beautifully. Rebuilt the mesial wall, rebuilt the distal wall. Again, you can see that before we even start the root canal. You must do that. If you don't do that, you're making a huge mistake, because now your walls are not sealed. You only have perhaps the buccal and lingual wall, and then you get saliva and bacteria seeping through the rubber dam, if you even use a rubber dam. Some dentists don't use a rubber dam. And your irrigants, when you put sodium hypochlorite, it has to have 4 intact seal walls to contain it, right? So it's important. As you can see, everything went beautifully. We went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. You can see decay on tooth number 27 also.